Strength. It's one small word that means so much. Franklin D. Roosevelt once said, "When you come to the end of your rope, tie a knot and hang on." Hi, my name is Taylor Stanfield, and today I'm going to be telling you about the chronic condition called fibromyalgia. Victims of fibromyalgia have no other choice but when they come to the end of their rope to tie a knot and hang on. The widespread pain throughout the muscles, joints, and soft tissues of the body is often more than they can handle. Fibromyalgia just recently started to become a more prominently discussed topic within the medical field, although I was aware of the condition much early on in life. My grandmother was diagnosed with fibromyalgia 8 years ago. I chose to research this topic not only because I wanted to know more about it, but I would also like to inform others about it. The exact definition of fibromyalgia is the chronic, widespread pain throughout the muscles, joints, and soft tissues of the body. It can occur in anyone, men or women, young or old. Although statistics have shown that fibromyalgia occurs more in women than men. The American College of Rheumatoids research has shown that nearly 1 in 50 million Americans are estimated to have fibromyalgia, and the condition is the second most common ailment of the musculoskeletal system. The condition occurs when muscles and tendons shorten, causing nerves to be compressed all the way down the spine and throughout the limbs. The condition has been around for many, many years, although there is no known date of when it was founded. Victims of fibromyalgia mainly have the same symptoms. The main symptoms that occur are, of course, the pain in the joints, muscles, and soft tissues of the body, but also depression, insomnia, fatigue, and stiffness comes along. The intensity of these symptoms all depends on the person's stress level. Someone with a lot of stress is going to experience these symptoms much more often and much stronger than someone with a low stress level. Staying calm and far away from stress is the key to decreasing the intensity of fibromyalgia. I conducted an interview with someone who has experienced fibromyalgia firsthand. Ms. Charlotte O'Neill says that, "I experience the depression, insomnia, fatigue, and stiffness of my joints daily. If I have a calm day and relaxed, then I know that I may sleep good that night and have a better day the next day. There's not a single medication that can help with all of the symptoms of fibromyalgia. It takes numerous medications to help with the struggle each day. Many take antidepressants and medication like Vicodin. Anyone that has ever taken any kind of pain medication knows that it may help with the pain, but often leaves you foggy and in a daze as if you're not yourself." As I researched my topic, I discovered that there is a very wide range of answers as to if there is a known cure for fibromyalgia. Some doctors believe that there is a cure through certain relaxation therapies and medication. Other doctors, such as Dr. Lamb, believes that fibromyalgia is reversible. He has done research and has discovered that through physical therapy, exercises, and medication that you can actually reverse the condition. Physical therapy and exercise makes you stretch your muscles, which helps them work correctly again. Through my research, I have taken Dr. Lamb's findings and made a daily physical therapy session for my grandmother so we can test his theory. After finding many answers to my question, as if there was a known cure for the fibromyalgia, I discovered that although there have been many strides taken in the past few years, there is still no known cure for the indefinite that can indefinitely cure fibromyalgia. The chronic widespread pain throughout the joints, muscles, and soft tissues of the body, resulting from fibromyalgia, has affected millions of Americans. From the depression, fatigue, insomnia, and stiffness of the joints, life has become a daily struggle for the victims of the condition. By lowering stress levels and exercise, fibromyalgia can be somewhat manageable. Some think strength comes from the outside of the body, through strong muscles and hard work. Fibromyalgia patients would have to argue that strength is something that comes from within. It has nothing to do with your outer appearance, but comes from a drive deep inside to keep pushing on through the pain. Ralph Waldo Emerson once said, "We acquire the strength we have overcome. Every day a fibromyalgia patient overcomes the pain, they acquire strength." So with every new day, they have the strength to push through and show the rest of us what strength really is.